So I've had a fair lot of patients over these years, and there are a few that you see and they kind of stand out. I remember a few years ago working in the emergency department, I had this young lady who apparently wanted the doctor's help because, according to her, she had some swelling in her stomach. And I asked her on the day what she thought it could be. She had no clues, it's just been growing. So, as a clinician, the first thing that comes to your mind when you hear this is a possible tumor. And that's not good news for anyone. But she was quite young, looked otherwise healthy, a bit pale, but still could still pass for a very healthy young girl. So I said to her, any chances of pregnancy? She denied flat out. Examination wise, she really had a really protuberant abdomen, quite swollen, and I could not really put a hand on what was going on. So I took a few other important details and then I said, okay, since you're surely not pregnant, you've got no other risk factors, we will be going to do a scan. We needed to do a CT scan to be able to tell. And this was early morning, about 4 a.m. So I quickly arranged a scan for her, got her to wait her turn, and then they came and wheeled her to the scan room. And I went on with another patient. So not quite long after that, the lead nurse called out. She said, OG, they want you at the radiographer wants to have a word with you. I'm like, what's going on? Has the patient collapsed on the table or what? And I left my patient, excused myself, and went to the scan room. And you can't believe what it was that we were really dealing with all this time. So this lady was 9 months pregnant, in labor, and we had to, from there, wheel her from the scan room straight to the labor room. We never stopped talking about that. So it's strange that people could go a whole 9 months. For me, that was a first, but I later realized that there are people who are in denial all through, or they just don't know, or they don't associate it, they don't think it can be, and they just stay in denial 9 months through all the interns, they missed all the prenatals, all the tests not done, and then they turn up in the emergency pre-delivery, wanting to have this tumor, this swelling on the abdomen sorted out. And I realized my mistakes. Obviously, if I had expanded my horizon, probably I could have picked it early. But these are the strange things that you can see. So going away from that, just this week, I had another one. And obviously, these things, the memories of them keep staying. You don't forget it. You're always on your toes when you have something similar come true. So I had a new one, which was a lady who was, I think she was about 39, 40, and she told me that she was pregnant. So it's quite a contrast. She said, I'm pregnant, I've been pregnant, it's 42 weeks now, and I've had no help whatsoever from the health system. I'm like, how long have you had no help? She said, well, that she had a bleed about 3-4 months ago, was taken to the hospital, and then they discharged her, still let her go. Baby is not yet acting like he wants to come out. And I got all my suspicious index out, and I was like, okay, so when last did you have a period? He said, well, with her pregnancy, she tends to have a period all through her pregnancy. There's no break, and that's peculiar to her. Right. I said, okay, we need to do a few tests. Obviously, looking at her, she did look distended, but it didn't match up. It didn't really match up that she could have had 42 weeks of pregnancy, been in several health institutions, and nobody was taking responsibility for her pregnancy. I said, okay, we need to do a few things. We need to get at least a urine pregnancy test done, and then make a plan for some more investigations. All right, she reluctantly agreed, said that she doesn't feel like doing a urine, but eventually I understand that she did one. And true to my expectations, it was a negative pregnancy test. We've got her booked for a couple of scans, a few things to be sure that there is nothing untoward going on.
When I want to explain it, my head will be headache me.
So there are people on all sides of the spectrum. There are people who are and who are not. And underlying all of this are probably, at least for the latter one, I believe that there's something psychological going on, but we'll get to the bottom of it. My name is Dr. Oji Obiora. I'm a GP with a special interest in YouTube. And please, for your information, the characters have been twisted, changed, and they don't represent anyone alive right now. It's just hypothetical, but things that are very close to this have happened, and I'll keep bringing such lectures down the road.
So what I'll just do now to tell Igwe, say me they organize an award for you, because you need the award.